My name is Eli Coleman, and I am professor and director at the program in Human Sexuality at the University of Minnesota Medical School. And today I want to talk about the concept or the construct of sexual health, how it has been defined, and the current challenges and opportunities that we have to promote sexual health. In this certificate training program, students are asked to promote sexual health in their communities, among individuals, couples, families, in schools, as educators, as counselors. But when you are going to promote something, you have to know what that is. And if you asked a number of people what is sexual health, you probably get a number of different definitions from different perspectives. What I'm going to try to do is to review the development of the construct up to very recent times, and as I said, talk about some of the unique challenges and opportunities that we have to promote sexual health in this new millennium. I think that, as I said, it's important to know if you're going to promote something, you need to know what it is that you're promoting, so a definition is important. But also, it puts some boundaries and limits. It can be limiting, it can be expansive, depending upon your definition. And so I think that that's why these definitions are important. And I think that you will see by the end of this, when I talk about some of the most recent constructions of sexuality, they have a lot of implications for policies, for funding, for the direction of sexual health in this country. The construct of sexual health is just that, a construct, and it is a product of a particular socio-cultural, historical, and political climate. And I think I'll demonstrate that to you as well. And as I said, I think it's important to understand the genesis of the construct, its evolution, and the environmental factors that have influenced its development. The early sexologists in the early part of the century, the concept of sexual health didn't even exist. We talked about sexual hygiene, as that was a term that was used at that time. But if you looked at their work, I think it was really very similar what we understand as sexual health today. And it's notable that the early scientists were not just concerned about understanding human sexuality, nor were they just interested in the amelioration of sexual disease or disorders, but they were really pioneers in fighting for a better climate, a better culture that promoted sexual health for all citizens. The construct of sexual health wasn't born until about 1974, and I'll go through that history. And I just note that it was born out of the second sexual revolution of this century. The first sexual revolution being the very focused on the rights of women and the overthrow of Victorian attitudes of sexuality. But in the 60s and 70s, and that's what we mainly think about in terms of the sexual revolution, but we forget the first one. And but the sexual revolution of the 60s and 70s further involved liberation, but it was also focused on wellness and self-actualization. And there was a very important document that was published by the World Health Organization in 1975, which was a result of two technical consultations in 1972 and 1974, where a number of sexologists were brought to Geneva at the headquarters of WHO. And in the midst of this sexual revolution, there was a lot of concern about how do we educate, how do we address sexual problems in our culture. And so they started to talk about, well, first of all, we need to figure out how to train people to be able to do this work. And as they stepped into it, they realized, again, if we're going to promote sexual health, we really need to define what that is. So actually, this is when sexual health was first defined, and the construct was really born. And here is the definition of sexual health that was adopted by the World Health Organization at that time. Sexual health is the integration of somatic, emotional, intellectual, and social aspects of sexual being in ways that are positively enriching and that enhance personality, communication, and love. Again, it is about wellness. It's beyond the amelioration of disease or disorder. But I think one of the things that is very striking about this definition right off the bat is the statements about the right to information and the right to pleasure. And again, those were things that were born out of this sexual revolution of the 60s and 70s. After that, not much happened at WHO, but that document really started the whole field of sexology throughout the world, and that was a seminal document that was used to give an imprimatur to our field, having that world body recognizing sexual health as important as physical health or mental health. The European region of the World Health Organization held a number of consultations in 83 and 87, trying to further define sexual health, what causes it, how do we measure it, but there was a lot of concern about that about the construct of sexual health, and these meetings ended up just with a lack of conclusion. Whether even we should define it, there was a lot of concern about governments controlling people or the medicalization of sexual health. And so this really kind of stopped the whole process. But also, if you notice that this is in the 1980s, the 1990s, this is now, we're starting to see the backlash to the sexual revolution, and this may have played a role. But in the 1990s, we had a new revolution, a new sexual revolution, and a myriad of public health problems related to sexuality, and this really became a mandate to address sexual health again. The HIV epidemic was one of those major factors that sort of forced governments to think about how do we promote a sexually healthier world. But much like the sexual revolution of the 60s and 70s, there was a lot of scientific advances as well as the dramatic social and economic change that was occurring at that time. The onset of the internet, the HIV medications, the protease inhibitors maybe had almost the same powerful effect as the contraceptives influencing the sexual revolution of the 60s and 70s. So the regional office of the World Health Organization took up the issue again and some consultations that were held in Guatemala in May of 2000. And they published this report. And this was a very important report because it reviewed the definitions of sexual health and tried to dust it off and come up with a new definition reflecting the current political and social and cultural times. And I'm going to just review that definition, and you'll see some of the similarities from the first 1975 definition, and you'll see some differences. So sexual health is the experience of the ongoing process, and I've kind of underlined in the slides some of the interesting words. So instead of it being a state, the Pan American Health Organization sort of recognized that this was more of a process of physical, psychological, and social cultural well-being related to sexuality. And it is evidenced in the free and responsible expressions of sexual capabilities that foster harmonious personal and social wellness, enriching individual and social life. It is not merely the absence of dysfunction, disease, or infirmity. And a very important statement in the POW definition: for sexual health to be attained and maintained, it is necessary that the sexual rights of all people be recognized and upheld. So first of all, this definition asserted that sexual health was contingent upon society's efforts to protect, promote, and preserve the sexual rights of every citizen. And it reasserted the point made in the 75 document, which recognized sexual rights as an essential condition, but had never been really explicitly stated in the first definition, but it was now stated in the 2000 definition. And then in a very significant step, the authors of this publication attempted to clarify the concept of sexual health by operationally defining it through the articulation of what are sexually healthy individuals, and also what are the characteristics of a sexually healthy society. Just about at the same time, here in the United States, the U.S. Surgeon General, David Satcher, started to develop a what he called a call to action to promote sexual health and responsible sexual behavior. And again, like the HIV epidemic spurring this new interest in sexual health, other countries like Australia and the United Kingdom started to develop national strategies to promote sexual health. But in the case of Australia and the United Kingdom, they were more specifically tied to HIV prevention. I think that one of the remarkable things about the Surgeon General's call to action was seeing sexual health much more in complex and diverse ways, and developing a national strategy to promote that. A new definition was crafted for the United States audience, and this definition was consistent with the previous definition, but also emphasized the importance of individuals to understand and weigh the risks, responsibilities. And this was the concern of, not having just rights, but also the necessity of having responsibilities, and to encourage people to act intentionally and responsibly. So I'm not going to read the definition, but I'll just point out one part of the definition which reflects that social and political climate, is that in the definition you have to practice abstinence when appropriate. And here we were in the midst of abstinence-only education, and there was a real bow to the abstinence-only people, but not giving in completely, because recognizing that was when appropriate. You will notice in this definition there is no mention of rights, even though the United States is built on the Bill of Rights. They said sexual rights is off the table. And although in the definition I think that there are implications for the responsibilities to give people information, etc. And one thing that I think is one of the debates in all the definition of whether you include the term pleasure, and in this definition derive pleasure from it was in that definition, and you'll see how significant this is as I move on. So this has been the contentious issue in the WHO revision of is this whole issue of pleasure, and a lot of nervousness about this. But again, remarkably, this was included in the Satcher definition. And in some ways, you think about that as kind of revolutionary, that governments, policies, and public health approaches designed not just to avoid problems or illness, but to actually promote pleasure as an essential ingredient of well-being. The World Health Organization, in response to these efforts and through some other pressures, we encouraged them to revisit the 1975 definition, and they held an international consultation to discuss approaches to promote sexual health and to work on some revised definitions of sex, sexuality, sexual health, and sexual rights. And so as a result of this consultation, and you have to understand again the context, here there was a global public health imperative. There was a real, getting the definitions approved at WHO level much more difficult. A world that was much more torn apart over sexuality and morality. The Bush administration at that time, policy of abstinence-only education, and they had a very strong influence over World Health Organization. So there was a lot of nervousness on the part of WHO to even step into this. And they had to get other world bodies like the Vatican and the Islamic countries to come on board with this new definition. And amazingly, they came to these definitions and a more clear articulation of other concepts like sex. I mean, if you're going to promote sexual health, you have to define, okay, so what is sex? So they came up with this definition of sex, which again I'm not going to go over, but the important point is the clarification of the constructs. Sexuality, what is sexual health? Well, we know that it's more than sex, it's much broader. And they came up with this definition of sexuality. And then they came up with this revised definition of sexual health, and this was published in a report that finally made it out of WHO in 2006. And I think the significance of this definition is two very important things. One, it says the possibility of having pleasurable and safe sexual experiences. And the other is that when they started this consultation, they really thought sexual rights is we're just not going to be able to get everybody on board with this. And yet they included the statement for sexual health to maintain and maintain the sexual rights of all persons must be respected, protected, and fulfilled. It was amazing that the people came there and they said very strongly to WHO, how can you have health without rights? And so they put it into the definition, and not only that, they articulated a definition of sexual rights and articulated the various types of sexual rights that people should have in order to be sexually healthy. And so this was an amazing advance, and as I said, a very surprising acceptance and articulation of sexual rights that was there in 75, but much more strongly supported in this new definition. And the concept of pleasure, was included in the 2002 working definition, which was also a big advance. And then as a result of that, WHO developed a strategic plan and conceptual framework in order to carry out this work. The problem is that it really stalled. We're talking about 2002. Again, the Bush administration had a very strong influence over the World Health Organization, and they were very afraid. So the meeting report, didn't get out until 2006, and not much happened during those years. But in 2008, the World Association for Sexual Health, well, actually in 2005, they had a Congress and made a declaration of sexual health to align the UN Millennium Development Goals with the sexual health goals, essentially stating that you cannot have a healthy society or well-being of a society, or reduce poverty or war without really addressing sexual health of the. So here are the different Millennium Development Goals, eradicating poverty and hunger, improving maternal health. Some of these are obviously tied to sexuality, but others, like environmental sustainability or poverty and hunger. How is sexual health? But the WAS developed a declaration which said you need to promote these aspects of sexuality in order to attain these Millennium Development Goals. And I think that this document spurred on some new development to recognize that sexual health was essential for human development, that sexual health was important as physical, mental, sexual health, and that leads to human development. And then if you have human development, you're going to have sexual health. And this is an interaction. The responsibility of the state was made very clear to respond strategically and comprehensively to the plethora of sexual health problems. Now, most recently, and the most up-to-date, I want to tell you about what's happened here in the United States, sort of in a response to this. Here we are now in the Obama administration, and all of a sudden there's a more openness in the Centers for Disease Control to develop a sexual health initiative, recognizing again the myriad of sexual health problems, and really need a comprehensive approach to address this. In many ways, this was like an attempt to revive David Satcher's call to action. And so there was a consultation in April 2010. The meeting report was published in 2010, and one of the recommendations was to develop a definition of sexual health. And so this definition was just ratified by an advisory group on May 9, 2012. And I just want to point out a couple interesting aspects of this definition, which are a little unique from the others. First of all, the first part is pretty similar, but all of a sudden, guess what gets put in there? And spiritual dimensions. This was a clear nod to the conservative religious right and the emphasis that faith-based communities have had wanting to play a role in the promotion of sexual health. And then if you go through this definition, do you see rights anywhere? No. Do you see pleasure? It's gone. The closest thing that you have is fulfilling sexual relationships. You can't have pleasure by yourself. You have to have it in relationships. So it's, and they insert families, individuals. And so it's a positive step for the Centers for Disease Control to adopt, although this is still under consideration. This is making sexual health a national priority. And it follows the legacy of the call to action by David Satcher, and also some other important developments that happened. In 2010, we finally had a national HIV strategy, and in there is the emphasis on using a sexual health approach as one of the main components of HIV prevention. And then the articulation of Healthy People 2020, which had reproductive and sexual health as a leading health indicator. And then we finally have in 2011 a national prevention strategy to move the nation away from just sickness and disease to one based on prevention and illness, and reproductive and sexual health is one of the 7 priority areas. And the other interesting development is March of 2011. We have an Institute of Medicine report on the health of lesbian, bisexual, and transgender people, talking about the importance of improving sexual health among these minorities. So we have tremendous challenges yet to go. This is always still a very contentious area to talk about sexuality, but these are real opportunities that we have now with the Centers for Disease Control, talking about these issues, defining them, developing a national strategy. And recently there's a coalition that is building to include NGOs, health plans, schools, faith-based organizations, professional organizations, to get together so that they work collaboratively to promote sexual health. And CDC is thinking about a sexual health report card, to look at what are the research needs, how do we measure sexual health, the importance of training healthcare providers, consultation with health departments, with faith-based communities. And maybe we should have an Institute of Medicine report on sexual health for all Americans. That would be very nice, and that's one of the opportunities. All of the definitions and strategies that I've talked about have some similarities. It's all about creating better climates, more access to information and education, prevention strategies, access to care, more research on human sexuality, and evaluation of programs. And this is just going to be imperative because as governments struggle with the myriad of sexual health problems and the burden of disease, and this is costing us a lot, we can't keep on in these silos of dealing with HIV, pregnancy prevention, domestic violence. They're all really related, and we need to really develop these national strategies. And clearly, sexology and sexologists have been playing an important role to address these issues, whether it's the HIV epidemic or other sexual health problems. And what is exciting is that our field is maturing, and it's becoming mainstream, and we are at the table. We've articulated in all of these meetings and all of these definitions, we've been at the table. And it's a good time for sexuality and sexual health. We have more publications, we have more funding for research than any time. And as I said, when CDC came out, we had this opportunity with the new administration. But the question that is on the table is what will happen in a new administration. And the whole process at CDC has really stalled at this point, waiting for the outcome of the election. So it's just an illustration of how political and social factors play a role. But I am an optimist, and I really do believe that we will prevail, and we will create a sexually healthier world in the coming decades. Thank you very much.